to be giving the benefit. However, we can see that today there had been some 530 plus deaths. So that is because there are so many patients admitted before this social isolation properly started. So we will be hearing more deaths in coming days and weeks. However, we should remember that in normal days, we don't tell every death in numbers. We don't, in the evening, we don't telecast the public that we have had so many deaths in this country. We don't tell that. So don't get panicky about it. Like, don't panic about number of deaths, because most of the number of deaths are in old age and with very sick people. And young deaths are still less. That doesn't mean that no young deaths. There are young deaths. Deaths will happen in all age groups except very small children. However, unfortunately, sadly, we had a very young child dying yesterday, 13-year-old. However, deaths in that age group is very, very minimal. It's about 2 deaths per 30,000 children. So 2 deaths in 30,000 infected children will be the norm. So we don't need to panic about it. I can see that people think like, if you get coronavirus or COVID, would I die? That's the question. So 80%, you don't even have to go to hospital, so we don't need to panic. If you are old or having medical conditions, then there is a high risk. However, there is, in that age group, like in elderly people above 80, the death rate is about 15%. That tells us if 100 people get infected in the age group of above 8, 15 are going to die and 85 are going to recover. That's the good news of this statistics.
So even at people at that age, 80 years old, there's only 15%, 15 people will die out of 100 who get infected.
85%,
right?
85 people are going to recover. If I were to tell another story, a lot of people would have watched in BBC yesterday. George Alagaya got infected. He is diagnosed with stage 4 cancer. He has had many cycles of chemotherapy. So he's a very, very high risk patient. If it was you with cancer and stage like so many chemotherapies, if you get this COVID-19 or coronavirus, you would think, oh God, I'm going to die. But he survived. He survived. And yesterday he was giving an interview on BBC. So that's good news. So he was treated in an NHS hospital and then he survived. So there are lots of surviving people. Therefore, the overall death rate will not be that high. Again, people are only talking about the death rates from the hospital admissions. We are not calculating the people who are roaming around or self-isolating in their houses with COVID infections. So if we put everybody together, all the patients who are having symptoms or in the community who are not diagnosed, then the death rate would not be that high. It will be very low. So that statistics will only come out after this epidemic settles down. So we wouldn't know, but my guess is it may be very, very small. So some people think, this is going to be a big disaster and kill a big percentage of the population in the world. It's not the case. It's going to be a small percentage.
Okay, that's quite interesting. We have a little bit of myths being brought in by friends and studio. There's been in WhatsApp, it's been circulating about ginger. Ginger can be a treatment. You drink ginger every day, I don't know how many times, you will not see the coronavirus. Is that right?
No, there are lots of fake WhatsApp messages. I don't know why people do that. There may be certain hidden agenda. We have seen some messages coming from India that if you eat meat, you will get COVID-19, so don't eat meat. That may be having this message may be having some hidden agenda. Likewise, not only ginger, they are promoting so many other items, saying that if you take this one, you wouldn't get coronavirus, or if you get coronavirus, take this particular thing, or ginger, or so many other things. So if you I don't think there's any evidence, and I've spoken to people who have taken it. I don't see them quickly recovering. So I've been in touch with so many people in UK and outside UK who have had this infection, and they have not seen any improvement. What they've got is severe gastritis. One of my friends called, his son had this infection, and then he has taken ginger and so many other things, finally ended up with severe gastritis, and he had to be treated for gastritis. So there are lots of fake news messages, fake news. If you believe these fake news and try to treat yourself with these things, sometimes you will end up in side effects. And also, if you believe this and wait till you get an infection,
ginger is not a treatment at the moment. Is that right?
No.
Okay. Next one is
because if you believe in this fake news, it's going to be counterproductive, sir.
Water gargling. This is something like if you keep gargle with water, or you put warm water and salt in it, and you keep gargling. I'm not sure how many times a day. Does it prevent this virus?
Yeah, we saw a lot of WhatsApp messages, and their argument was this virus is in your upper respiratory tract, especially throat. So if you gargle with hot water, you should be able to kill the virus. It's not true, because the virus has already entered the body. It's in your whole body, not only in your throat. So you can't just kill the virus by gargling water. And sometimes I've seen messages saying you gargle water or keep drinking hot water every 15 minutes.
Dr. Naser,
if you're going to do that, you can't. You literally you can't live.
Excellent, Dr. Naser. We're going to get a call. There's a call online. Hello.
Hello, good evening.
Good evening. Hello, welcome to our channel.
I've got two small questions.
Excellent, go ahead, please.
One is, I'm 73 plus. I've got an underlying heart condition. I had a heart bypass operation in 1995, but I'm quite stable. And I also got mild asthma, which is also well controlled, for which I take Symbicort Carbohela 200. Morning and evening. Now, what I should do, obviously there is a fear that if you catch, it will be severe. Although I was not within the list of 1.5 million vulnerable people in this country, but what sort of care I can take? Like, for asthma, I can check my peak flow meter time to time. If my lungs is a bit weak, I've got an oximeter. I can check my oxygen percentage level. Any advice like that?
Excellent. So you have a heart conditions, and you have some breathing problems, which you take some inhaler. And Dr. Naser, would you like to take this question?
Yes. For any person who is old and having underlying medical conditions, the most important thing is to do your standard precautions, like hand washing, not getting exposed to others, and I would say for elderly people with underlying medical conditions, better to avoid going out. So don't go out, don't go on shopping. Ask your relatives or friends to do your shopping, and then be in your house. If you are living with your extended family, with your grandchildren or children, and then avoid mixing with them. Avoid in the sense you can't completely avoid mixing with them. However, you can at least minimize mixing with them, because especially children might catch the infection and they will be completely asymptomatic. They may not have any symptoms. So standard precautions, hand washing, and then not going out, social distancing. Those are the standard conditions. There's nothing which can be taken as a precaution, like no medications, no alternative medications have been proven. So only thing is to be cautious.
Thank you very much, Dr. Naser. Does it explain your question, sir?
Hello.
Thank you.
Yeah,
So do you have another question?
Yeah, if a family got symptoms, then there will be a self-isolation. Now, how we are going to cook and other things, the sharing the living room, kitchen, how that is going to work?
Yeah, if somebody in your family is infected or suspected of having infection, then you should stay in your room. You should minimize coming out, and you should use separate utensils and towels and everything separately. And if there is a toilet, separate toilet, you should use that. Nobody else in the family should be using. Or if there's only one toilet, and then what you can do is everybody else can use it, and then finally you use it after cleaning the doorknobs and things. Minimal contact with the others is the most important thing. Or you can move out of this house and be with somebody else who have not got symptoms, but that may not always be possible.
Thank you very much, Dr. Naser. Next myth is steam inhalation. Will it help?
At the moment, there is no evidence, and there are lots of WhatsApp messages again circulating. And there were two WhatsApp messages. One said Chinese doctors did postmortems in patients, and then there was another message saying Cuban doctors came to Italy and they did postmortems and found there are mucus plugs, and therefore steam inhalation will help. This is all fake news, because nobody would do a postmortem on a dead patient with COVID-19 or coronavirus. So nobody is going to do a postmortem. So that's all lies, fake news. This steam inhalation is also another fake news. However, if somebody has got COVID-19 or whatever, any other upper respiratory infection, if they want to do steam inhalation, that's absolutely all right. It's not going to cause any harm. However, we can't say it's a treatment or it's going to reduce the duration of illness.
Steam inhalation is not a treatment, but they could do to
steam inhalation
help
is
their
a
symptoms, maybe.
thing. So you can, if you wish, you can do it.
You can do it.
Yeah.
That's fine. Drinking hot water every 15 minutes.
Yeah, that's I think we touched upon. If you keep drinking hot water for 15 minutes, you will not have any time to do anything. You will just keep drinking and then going to the loo. So it's not going to work.
The next one is
And
quite interesting.
It's not proven at all. It's a fake news again.
The next one is quite interesting. Cuban doctors are doing magic in Italy. They are discovering lots of new medicines and they are curing Italian patients. Do you know anything about this?
I've carefully checked it, because there were lots of messages sent around. I don't know why these messages are being sent and who is producing these fake news and for why. What's the agenda? I don't know. So many foreign people have gone to help Italians, because Italy was hardly hit, and Chinese teams are gone. I don't know whether the Cuban teams are gone. However, Cuban doctors haven't got any treatment, new treatment, or any cure, or any magic cure or vaccine for this one. That's definitely true. There's no magic by Cuban doctors.
Excellent. Hopefully they will find something in the future. But there is a call online. Yeah. Would you like to connect to us? Hello.
Assalamu alaikum.
Wa alaikum assalam. Welcome to Health Talk with Dr. Akram on 9 TV.
I am going to ask both of you, doctor, a simple question, which is, how long does this virus survive on its own, like on different surfaces, like we are getting parcel, we are getting foods in. So people touching those, if somebody touched those.
That's an excellent question, sir. I'll pass to our special guest, Dr. Naser.
Thank you very much. Thank you. Jazakallah khair. Okay, assalamu alaikum.
Wa alaikum assalam.
Some of the numbers I can't tell you offhand, but generally, in most surfaces, it can survive for average about 3 days. In glass surfaces, it was thought to be about 5 to 7 days. And in most of the surfaces, it will survive 3 days. And it also depends on the humidity and the temperature. So in some very humid, temperate climates, it can survive less. However, we don't have data. There's only one study properly published which showed about 3 days is the average. And in droplets, which is suspended in the air, it can survive up to about 3 hours.
Are there any good news for our viewers in countries like Bangladesh, Pakistan, Sri Lanka? Is the temperature in those countries, the high temperature, does it prevent the spread of the infection, or does it kill this virus?
There were lots of messages around before at the initial phases of this infection in the epidemic was starting. People thought these viruses wouldn't survive in temperate climates like Southeast Asian countries. However, now the way things are going, it looks like it's not the case. So we would have been very happy if it was the case. I can see, every day I'm in touch with Sri Lanka, where the number of cases are increasing. And that's a very, now at the moment in Sri Lanka, the temperature is more than 30 and very humid. Still, there seem to be infection going on. Therefore, we can't be assured that the weather would protect us. No.
Dr. Naser, before we wrap up the show, we have another caller online. Hello.
Oh.
Hello, you're online.
Assalamu alaikum. Hello.
Hello, sir. Go ahead.
sir.
We can hear you.
আচ্ছা এই ভাইরাসটা বডির মাঝে কয়দিন থাকে আর এটা সিম্পটম অনেক রকম তো এটা ক্লিয়ার হইতো যে এটার সিম্পটম মেইন সিম্পটম কিটা তার লাগে আজ যে 5 দিন ধরে আমার সুরাতুরা খাওনি স্নিজিং
Excellent.
থাকছেন
Okay, thank you, sir. Okay, our caller would like to know the symptoms of this virus.
Yes,
would you like to quickly say?
Yeah, very shortly. First thing is, this virus, the problem is up to 14 days of the virus getting into your body, you would not have symptoms. Some people would develop symptoms within 5 or 6 days, but most people may be asymptomatic. Therefore, we must be very careful. You can easily get an infection from a person who is not having symptoms. The most common symptom is fever. Other common symptom is sore throat. So people sometimes think, okay, I had this drink, I had this fruit, or I was allergic to something, I developed this sore throat. It's not the case. Now, if you get something like sore throat or fever, you should suspect COVID-19 or coronavirus. Other symptoms are headache, aches and pain in the body, feeling very lethargic, that means tiredness. These are the other symptoms. You can also have sneezing, but sneezing is less common. And also, there was a new symptom observed by ear, nose, and throat surgeons that 30% of people seem to be initially having loss of sense and loss of smell. However, that's not yet properly proven that it's very specific to this condition. It could happen in other viruses also. However, in this epidemic, during this epidemic, if you think you have lost your smell or sensation in the mouth, and then that may be an early sign of you getting this coronavirus infection. So most common things are fever, sore throat, aches and pain. Those are the most common symptoms.
Is it diarrhea a symptom? abdominal pain?
Yes, you can have abdominal cramps and diarrhea, but it's not very common. However, if you develop abdominal cramps or diarrhea, and if you feel very tired, rest and observe yourself. Don't go and exercise. Because I watched an American on YouTube telling that he developed abdominal cramps and diarrhea, settled down in few days, he went for exercising. After exercising, he became really ill. So you should be very careful. If you develop any symptoms or signs, don't go and exercise.
Dr. Naser, it was really a pleasure to have you here. And we had a great time, and hopefully I think if it really helped our viewers, and they're going to be with us again. And hopefully we would like to get you the channel for another special program on diabetics or your special interest endocrinology. And until we see you next time in this channel, we would like to thank you from our bottom of our heart, and thank you very much. And for our viewers, it was a really good time, and hopefully we have answered certain amount of your questions. And until we see you next time in a similar program, Iron's Health Talk with Dr. Akram, please take care of yourselves. Please listen to NHS advice. Please stay home. Go out only if it's necessary. See you again. Thank you. Bye-bye.